and believe it or not, I was finally gained access to it. The interesting thing is that after being presented with the administrator who had multiple prison tats and piercings, and I asked for a business card, she did not have one, that eventually a nurse came in because I kept asking about HIPAA regulations as if my father came over to access the account, etc., and more importantly that I had been dropped off of the account after 1 year. Communications. This is what this is all about, because the bottom line is people don't know about HIPAA regulations and the lack of access to an account. Yet my father's doctor still calls me asking for advice because I had both of them on a diabetes program to where my father gets his for free and mom's was discounted. So back to the being removed from the account, I was told that I didn't sign anything, and I told them they were crazy because the bottom line is I was speaking for the patient for well over 2 years, and all of a sudden my name dropped off. Eventually it was sent to legal in Baltimore for Johns Hopkins, and in turn I was eventually regained access to my mom's account. And the fast forward of the story is that what they didn't know is that my mom was on her deathbed at the time. So they are making a buck off the backs of the people of Maryland by buying all of these community physician things, whatever it was before it became Johns Hopkins Community Physicians. And that as my mom laid on her deathbed, and as I stated to them, I have years and years and years of her records. Okay. Number 2, I finally gained access to the records, and here's the new stuff. And did you know that my mom had stage 3 kidney disease that, well, I didn't know anything about it. Because the bottom line is, I had no access to the records. 170 pages later, I do have access to it, but it does me no good. Why not? Because I was busy preparing for a funeral. So I actually gained access to the medical records on 12/12 while I was busy planning her funeral. And I ended up with the funeral date of December 15th. Doesn't do me much good, does it? Administrator with the prison tats and the nurse who came in, who simply could not understand the fact that you absolutely must have communication with the patients. And as the nurse stated to me was that, well, we communicate with the patients, and I'm saying, no you don't, because I was communicating for the patients, and as stated in my earlier video that I never had access to the online account because they never told me I had to sign a separate form. Just ridiculous. Stupidity. Charles County thinking everyone's stupid. I'm an alumni, you effing idiots.